All right, you guys, we are back from our break, and today, as I told you, we have a special guest with us. But before I go back and speak to my guest, I want to take a little moment to say thank you to Director Alan Daphnis for such an incredible job that he is doing in the community. It's not only our Haitian community, but he's doing it all over. So we put our hat down for Director Alan Daphnis for the great job he's doing. Brother, you are a legend. Keep doing what you do. And all the team, we say thank you for what you do. Again, we are here with Dr. JHINSSY Paul. So, how you doing, girl?
I'm doing
You look beautiful, girl.
Thank you. You as well.
It is such a privilege to have you come with us, so we honor you being here. And today I want you to just go ahead and tell us a little bit about yourself and what your journey was like, Miss Doctor. So what's up, girl? Tell me about yourself. Well, tell us about yourself. What's up?
All right. My name is, actually I have a long name.
Oh, yes.
Shorten it a little bit for you. My name is JHINSSY Paul, and I'm basically a doctor of occupational therapy. I specialize in different sections. I specialize in lymphedema. I'm a wound care specialist. I basically an educator for Alzheimer's and dementia. You name it.
This girl is so accomplished, y'all. It's like, what you talking about?
I just recently added a bodily contour certification to my list because we wanted to brighten the services. A lot of the clients that we see wanted us to get to that part of the business,
which is good,
of course, because everybody is all about beauty now.
Right? Oh, girl, see that, child, listen here. She's the hookup, y'all. If you want your face to look, we're gonna get to this.
Of course. Don't give them too much. So that's what we do. We don't only focus on rehabilitation and wellness. We focus on the whole function.
Okay.
So we do facials, we do bodily contour. If you, let's say that you go to get surgery, you have like abdominal surgery for instance. We do manual lymph drainage. We make sure that the swelling and the inflammation that you have in your body doesn't stay there post-healing, that you are healing throughout and recovering with manual lymph drainage, with bodily contour after. But there is a process to this.
Okay, so now we're gonna enter into those questions, and those questions are lengthy, so be patient, child. So tell us a little bit about Fescue Therapy Body and Wellness journey from its inspection, actually the services that you offer basically for the client that are out there.
Okay, so Fescue Therapy was founded in 2017. I was working in the hospital, seeing acute inpatient, of course, and I was seeing patient every day, and the first concern that they had was, oh my God, I'm adding too much weight. There's a lot going on with me. I can't walk no more even after physical therapy or occupational therapy. So one day I'm like, you know what, maybe I should do my own thing, because that's all they say to you, you're so good at what you do. So I said, why don't I just brighten it to the community and making sure that they know I'm out there, that I'm compassionate and I care about how people look. I care about how they feel. So I wanted to tackle the whole wellness holistically. So I went and founded Fescue Therapy, and I added physical therapy, occupational therapy, and speech to it. And as we were going, towards that route, I decided to add cosmetic.
Oh, wow.
So we do facials.
Right.
We do all kind of facials. We do dermabrasion. I'm not like, in the facialist part. Of course, we get certified staff to
do that.
To do that.
Okay, so basically what you're saying, you're not alone in the office. You're not the only one who's doing all the you know.
Of course not. You need a
Because I'm like, you
team.
would be burnt out. I'm like, how do you do all these things by yourself? But that's
No,
good.
no.
Okay, so you have a team.
I have a team, so we do, all our staff are licensed. We do bodily contour. We have different type of machines. We have M Sculpt. I don't know if you guys are familiar with that. This is the machine that actually gives you actual abs. I never even knew there was a machine like that.
Child, you gotta know, with all these, superstars out there, a day you see they all, like this, and the next day they are just like, of course you gotta know that
So they
those
extended it
machines.
to us. They said, okay, we're gonna extend it after like how many years now? So I'm glad
Wow.
that they did.
So then I'm gonna have to go and get me a
You
six
have
pack.
to. You have to. But you look good the way you are. You're already perfect the way you are. But if you need a little bit of correction, you know where to come.
Correction. What do you think? I think I need a little correction there. Okay, we'll think about that.
No, you look gorgeous. You look gorgeous.
Thank
So
you, likewise.
of course. We have different type of machines. So we have the multi-shape, and this is the machine that actually drain the fat
Wow.
around your stubborn area, which is your abdomen or your love handles. So this is a perfect machine for it.
So how is that like? Is it like is that a painful process
It's
or?
non-invasive. It's non-invasive. We're not cutting. It's not surgery. Actually, it's just non-invasive surgery. It just goes over the skin, the dermis, and the epithelium, and it just melts the fat gradually.
Get out of here.
And then you'll just see that your body is taking its shape.
Wow.
normally,
I mean,
day
I
by
know
day.
people worry about, being in, certain machine because of side effect that, the laser or whatnot. I mean, how is that like?
We
Tell us.
actually do an assessment for each particular individuals, making sure that there is no contraindications, it is safe for them to use before they even get the procedure.
Okay, that's awesome. So, okay, we know that you said you touch a little bit about the weight loss program. So, what basically motivates you to say, okay, I'm gonna not only work in the hospital, but I'm gonna go ahead and do my own thing, and you're gonna broaden it and put facial weight loss program alongside the traditional therapy that you do. I mean, what prompted you to do all that?
I'm thinking most of the patients that usually come to us, when they come for therapy, they come for a couple of sessions, and once they start feeling better, they're like, I'm not coming anymore. Then when they get home, they start feeling the stiffness of the body because they're not moving, they're not doing any exercises, they're not eating well. So therefore they regress to where they were, and even worse than before when they had a hip surgery or they had a knee surgery. So by basically bringing this type of services to them to keep them healthy day by day, making sure that they eat healthy, they have the good nutrition, giving them guidance to make sure that they keep their weight at a certain healthy level, that will basically improve their quality of life.
Okay.
So that is what drove me to get to that
That's
specific
great, girl. My goodness. So my other question for you. God, this girl looks she does so much. Y'all, it's like we try to suck everything in. But if some of you, you already know, if you need those service, we're gonna come to this where you can contact her and make sure you get some good service and get yourself all sexy. Because I know our ladies out there, y'all love to look good. So hey.
Of course, we have to stay in shape.
Yes, most definitely. And it's so crazy. I mean, I think that it's good to be able to have the machine to do, those type of things, because there are some people, it's hard for them to go out there to, do the exercise themselves, even though they're going to do a little exercise after they get
They need motivation.
Yeah, they need that motivation. So it's good that at least there's something that we can use that can cause us to be the person that we always, want to be.
Yes.
So yeah, doing your specialty, say service that you give. I see you talk about the lymphedema, post-traumatic surgery, recovery, lymphedema, treatment, contribution that you overall. I mean, tell me about an experience that you have with a client, concerning all these service that you give, like a testimony or something that you would have.
So most of our clients have the liberty to go either on Google or anywhere to basically tell us exactly how they feel after they have received our services. Most of the testimonial that the clients gave us or provide to our company is listed on our website. We have patients who come and said that, oh my God, I've never actually had individualized treatment pertaining to my care, to my needs.
Wow.
So that's what I do. I don't do group therapy. I individualize it to the patients, what's going on with them, to their condition, and making sure that they know this is what they need to do to get where they need to be. Health promotion, that's where I'm focusing, holistic health promotion.
So basically you have a treatment for that particular patient.
Based on the individual's needs.
Okay, so that's good that you don't, I mean, it's from what I'm hearing, you're not using, the same treatment for every patient that comes to the...
No, we do an assessment, so it's individually based. Let's say you come to the clinic and you say, okay, I would like to have contouring. And I see that you have, let's say you have just a little bit stubborn fat, but you have a major knee collapse, like it's inflamed and the leg is swollen. So what I'm going to do is I'm going to focus on the problem deficit. I'm going to make sure that the knee and the leg that is swollen is taken care of first before I can tackle that little stubborn fat, to make sure you're able to walk healthy and making sure that you're able to move from point A to point B easily. Because if you can do that with this knee and this leg and you're looking good with the abdomen, then there will not be a balance. So there needs to be a balanced treatment.
A balanced treatment for it. Okay, that's good. So all right, so then since we know that you offer all these services, right? So we know that it takes time. So like let's say, what is your day like your day look like in an everyday basis when it comes to... Because I see there's a lot going on.
To go back to the testimonial, I wanted to add one of my particular patient. I'm sorry.
Okay, that's
I
good.
didn't quite finish that part of the question, and then I'll tell you my day-to-day life.
Go ahead.
I have a particular patient. Due to HIPAA, I'm not gonna say any names. Every time she comes to the office, she's like, "Oh my God, Dr. Paul, I don't know what you're gonna do to me today, but I went on Google. I had to post it. I had to say it because you are lovely. You know how long I've been searching for my legs to go down.
Wow.
You know how long I've been looking for this loving dose to go." And she's actually 95 years old.
Wow.
She came with her niece that was actually getting a bodily contour.
Oh, so
and
she's
then
like,
she decided,
I'm gonna get some of this.
and then I see her leg were very swollen, and I was telling her what to do. I said, "You're not a patient of mine, but I'm just gonna give you a little bit of..."
That's nice of you.
Of course. And then I said, "Just elevate your legs. Make sure you put compression stockings." She said, "They've been hurting." I said, "You know what? Go to your primary doctor, get diagnosed, and then whenever you're ready, come to me, and I'll take care of you." I've had this patient for about a year and a half now. I can't get rid of her.
That's what happened when you're good.
She keeps coming. Sometimes not even for treatment.
Wow.
Just to talk. She invites me to lunch.
Oh,
and
that's so
I wish
sweet.
I had time, but I said,
sweet.
"You know what? I would love to come to lunch with you, but I will want you to bring it to me. I will have lunch at the office."
I know, right?
Because I do have to follow ethics. I do
Right,
have to
right,
follow
absolutely,
ethics.
because you never
But
know.
she actually bought lunch and had it at the office with her.
Wow.
And come to find out, she lives by herself, and she basically posted on the website. She said, "We saved her life." Because she was going through a major depression. So from time to time now, I check up on her and making sure that she's doing okay.
That's very nice.
And that's what actually pushes me and reinforce what I do in the community.
And that's very important, because we have people now. When you go to a doctor's office, a lot of people says they're all about the money. They not really care about the patient. And for you to go out of your way to be able to sit down with a patient, to eat a meal with that patient, I mean, that goes a long way, because I know how busy as a doctor life can be for you,
Day to day.
That's what I'm like. Let's get to the with all these stuff going on here.
The day to day. So I don't only manage first care therapy as a clinical director. We have a team of about 10 staff. I'm actually in the process of hiring a director to help me, with the load. And but I also work in the hospital.
Oh my gosh.
Yes, I see patient in acute care setting and acute care rehab.
Okay.
So I go to the hospital on the weekends and on Fridays, and during the week I'm in my office.
Wow.
And I also go see lymphedema patients at home, and I'm also doing pediatrics. We see different type of population. So we see patients from 3 years old all the way and up.
Wow.
That's the rehab portion of it. For bodily contour, there are supposed to be a specific age. There is just criteria that, like, if you're above it, a certain criteria, and you have conditions that doesn't permit us to do body control, we won't do it, because we do have to follow guidelines and laws.
Right.
So I would say in a day to day, I would probably see about 6 to 8 patients, and the staff, because I have the staff that actually give you a little bit of relief. Most of the patients I see are the lymphedema patients, and then we have the estheticians, the medical estheticians that deals with the bodily contour and the hydrofacial and the facials, and then we have the front desk staff that I also manage.
Right.
I would say it's pretty busy. I work every day. I only have the evening off, so
that's good, because
I do take a vacation.
Praise the Lord. Thank God for God. We need that peace, child. Oh my goodness. So then,
you start early.
My goodness. So then, you would say in your practice, do you have? Because I know you said you do therapy as well. So physical therapy and occupational therapy, you do that as well.
Yes.
Is it within? So how big is that office for you to have all these things going on up in there, child?
Well, we have a few rooms. We have about 4 rooms. We have the spa that is on this side. So we set it up in a way that they go by appointment.
Okay.
So you have to have an appointment to come. There is no walk-ins. If you don't have an appointment, then we can't just take you as them.
Okay.
Because in the rehab portion, some people do need referrals to be seen.
Right.
And when they do have this referral, we need to actually plug them into appointments.
Okay.
And for assessments and treatments. So it takes, the front staff.
Right.
They are actually our stars, because they have to put the calendar in a way that they don't overwhelm the clinicians.
So for physical therapy and occupational therapy, I mean, in a day, like how many patients you see or, have in the office? Because I know physical therapy, you have to have the machine and so on and so forth for them to do at least, somewhat exercise. But how many patients would you see for physical and occupational therapy in a day?
Since it's per appointment, I would say during the appointment, I might have 3 patients in the office during the appointment. Once this appointment is over, then I take the next person, the patient leaves.
Okay.
So the room is never crowded.
Okay.
Because
So that's
they
good.
have their individual based treatment that they come at their appointment. So one comes, one goes. I would say about the caseload can be 6 to 8.
That's not bad. Because I know physical therapy can be, I mean, when it comes to occupational therapy, I don't think you have that many patients. I don't know.
Actually, per day, yes, we can. Because if our day starts at 8:30, I say 6 to 8 in a normal day. But let's say that we're busy and we have a lot of Medicaid patients, because I do take insurance as well.
Right.
So I take most insurance.
I hope so. Like, we're doing all these things, like, everybody got no money.
I know they have to come in. But the cosmetic portion is cash based, because the insurance won't pay for that.
I mean, like, why not? I mean, come on.
You to be beautiful.
They're trying to mess up my flow.
No, they want you to bring that money, go work for it.
Child.
So
Okay.
I would say that per appointment and the way they come, it's a flow. Like, you have to follow flow and give them their individual base treatment that's tailored towards them.
Okay.
And they come, it's usually 45 minutes to an hour for a treatment, depending on the insurance. And then they come, they do the sessions, and they leave. And they each know what time to come. If somebody's late, they have to reschedule, because
you scheduled by the, okay, that makes sense, makes plenty of sense. So now, okay, tell me what makes first care therapy from the wellness center in the Palm Beaches like different from any other therapy place?
I would say the way we are personalized care. We integrate our sessions and making sure we tailored it towards our client.
Okay.
Like I said, we don't do group therapy. We're not an open gym. The type of gyms we have is mostly for the weight management program, and then when the patient come to use our facility, we have like the way that we set up, we have it in a way that this is their moment. Okay, so we make sure that we tailor to their care. We incorporated the wellness portion, which is the holistic well-being part, that we're gonna treat you holistically. We're gonna make sure we not only tackle your physical, your occupational set that you need, we tackle the whole function. We're focusing on your whole bodily function, making sure that you achieve wellness and quality of life. Once we see you, we don't let you go after you finish and you graduated from physical therapy or you graduated from occupational therapy and we're done and we don't see you again. We do call you and making sure you're doing well.
That's good.
And we do send little education here and there. And once you're done with us, we make sure that you still continue exercising so you can keep on progressing with your quality of life and you are doing okay health-wise.
That's good.
So that is what we do.
I mean, many times you have patient that goes to doctor's office where the doctor, don't really have time to see the patient or to really, because they always either passing the patient to the next patient because they have so many patients that they are seeing and they don't have that, that time to really sit and talk and find out about the need of that patient because they trying to rush from here to here. So how do you, based on you said you have different treatment for each patient, have you ever get into a day where you're so overwhelmed, like you have patient are waiting, sitting there for you, like you don't know what to do with yourself?
No, actually, because that's why they
Let's be for real now.
I am direct and for real. That hasn't happened because the patient comes with their appointment. And let's say I'm not saying in a day-to-day basis things doesn't change or things happens, but what happens is I make sure that if you have that appointment that you will be seen, and I'm not gonna cut your session short. I'll rather come out there and speak and say, I'm so sorry that you have to wait a little bit, but you will be attended to accordingly. I'm not the type to send any patient away no matter what. But at the same time,
and that wouldn't be that wouldn't be a good look in your practice if you were to turn a patient away.
I'll rather reschedule them for them. I won't give short sessions. I'll rather reschedule them to make sure they get their full sessions, explaining to them exactly what I will be doing, and I will give them something, like I'll accommodate something that I know that will make them happy just for the wait. Customer service come along now. You do not want bad, reports out there. So you want to make sure that you give great services.
Okay, so this question basically here says, in what way do you integrate holistic approach to wellness into your practice?
Okay.
You're like, okay, like what's going on here? Tell us, child. You want me to repeat the question for you?
Oh, sure.
Okay, so it says, in what way do you integrate holistic approach to your wellness into your practice?
So I'm from my cultural background is I'm Haitian descent, and so I remember.
Haitian, y'all.
So my grandmother, my ancestors always uses, like, how they do. They use little leaf here and there to heal you, but in America we can't do that. We have that with prescription.
Somebody gonna sue you, child. America is a country of suing. Well, Florida per se, to be exact.
So I see that, like I said, a lot of my patients were coming and say, you only focus on the physical therapy and occupational therapy. I see much more about you, because when something is going on with them, I'm able to sit with them and educate them and say, oh, why don't you try this? Like, perfect example with lymphedema. You have a lot of wounds going on. We have a lot of broken skin. A simple water with Epsom salt and aloe will heal the skin. So what I've actually done is get with a medical doctor and say, okay, what can we do with this? And apparently there was something out there already, as long as they can get it over the counter. But since we can't get those over the counter, which is mostly organic, if they have a prescription from a doctor saying that get those, and they're able to use it to heal their wound. Like, I'm a wound specialist, I'm able to tell them use saline, use aloe, and I can treat the patient like that. But before I do that, I make sure that they sign consent. Hey, this is what you're gonna be doing for me, so I want this sued, you know.
So
speaking, I take a holistic view, making sure that organically they're able to do hygiene with whatever, like, you know, they at home, which is organic, not processed, water with Epsom salt. If the skin is swollen, you can't put hot water, you have to make sure that it's room temperature, and then you put a little bit of aloe vera over it, and then you rinse it with lukewarm water, and then making sure that the skin is clean and tack and dab it.
Yeah, because with lymphedema, you have to be very
crucial. You have to teach the patient how to clean and hygiene and put non-scented lotion. If they don't have any breaking skin, if they have breaking skin, I wouldn't put anything on it. But they do have to get, you know, anything that they put on their skin, they have to get it prescribed from a primary doctor. They don't want to put anything without a doctor telling them. Otherwise, they will cause harm to them.
So do you see a lot of lymphedema patients?
I do. I see.
Okay.
So, but holistic view is mostly like, you know, giving them a little bit of education, making sure that they're doing the hygiene, making sure that there are organic, proper topical lotion that is FDA approved, that they can use to heal their skin, and teach them how to go about it, and provide the appropriate education for them and appropriate exercises for them to follow, so they can get the progress that they need. Right.
Now we are talking about lymphedema. I know a lot of people may be like, what the heck is lymphedema? So I'm not the doctor, but I'm gonna have her elaborate, because that's a very serious, you know, condition out there, and people may not know what lymphedema is. So how about you tell the audience, you know, what is lymphedema?
So lymphedema basically comes, it depends on, it could be by trauma, or it could be genetic, you know, and you have two types. You have primary lymphedema, you have secondary lymphedema.
Right.
So when that happens to your body, let's say somebody have cancer, what happens is your lymph nodes, I'm trying to say it as simple so you guys can understand.
Like, don't be using like people like lymphedema. What is lymphedema?
That's why I'm giving
they can't even pronounce lymphedema. Like, what we're talking about?
So be simple. So primary and secondary. The primary, let's say you have cancer, and your lymph nodes are shot from the chemo and the radiation. So your body started accumulating like swelling all over the body, inflammation. And sometimes the fluid, because your body holds fluid normally, and when this fluid doesn't have a way to drain, which is within the tube of your heart, just like when you have blood flow going to the tube of your heart, and the fluid as well goes there to dissolve. When they don't have a way to the lymph nodes and the lymph node is blocked, that's when you're accumulating all this swelling, and that's what lymphedema is about. Like, you started getting swelling in your legs, swelling in your arms, sometimes your chest area, your abdomen, and then what I do is I go and I do gentle manual lymph drainage through the area of the lymph nodes, making sure that I open those lymph nodes, and then move those fluids to go drain into the tube of your heart, which is your chambers. And once I do that, it's a process, so it's not a one-time treatment. You have to keep calming and wrapping. We have to wrap the legs to give compression. We have to give compression stockings afterwards. So there is a process. So the patient has a plan of care. It could be from 6 to 8 weeks. We wrap the leg, and then we measure to make sure that the fluid is going away. And sometimes they have to get, you know, they have to go do chest x-ray, making sure that the fluid is not going where it's not supposed to be. So that's what lymphedema is about. It's just secondary, post-trauma. It could be genetic, because some kids are born with it. You know what I mean?
Right. Okay, so you guys know what lymphedema is. So
It's a chronic condition. It
Yes.
doesn't go away. It's not
It doesn't,
curable.
yeah, it's-
but you can sustain it, and it can be stabilized in a way. We can teach you how to stabilize.
Right. Okay, so the next question, we just have a couple more questions to go. So, can you discuss any plan of development for the first care therapy, body, and wellness?
So the plan we have, which we have already have in process, is to make sure that we continue doing what we're doing towards the community, making sure that we stick with health promotion and continue with the physical therapy, occupational therapy, and making sure that we gear to the cosmetic part of it. Right now, we are not called a med spa. We are called First Care Therapy, Body and Wellness.
Yeah.
So we make it
Long name? If you guys see everything, everything is so long.
I know.
She's very detailed, y'all.
We have to make sure we answer every question.
That's good.
So my plan is to make sure that we are on the map in a way that we become not only a rehabilitation and wellness, but med spa to it.
Okay.
And continuing with the weight management, making sure that we make people feel good, and we put our plan out there, possibly which other states instead of just staying in Palm Beach County and Florida, but we might possibly go to New York, become a franchise. So I have so many plans. I'm just
keep
gonna
dreaming,
thank
girl.
the Lord.
Keep dreaming.
I'm gonna pray and thank the Lord that we get to where we need to be. The plans are out there. The plans are out there.
That's awesome.
Yeah.
Okay, so another question: what aspect of your job you find most rewarding and the most challenging?
So what I find rewarding is when the patients comes to me, and the way they come to me, I see that the progress is happening fast, and they meeting their goals, and they are living a healthy life, and and improve their quality of life. That's my reward. Seeing the patients progressing and making sure that they follow every instructions in education, and they're able to achieve their goal.
Awesome.
Okay, what I find challenging is when they can't differentiate occupational therapy and physical therapy, or what we do.
What the difference is.
This profession and discipline has been here for a long time, and we're still finding people when we introduce ourselves, what is that? I'm like, oh my God. They usually say, you come to work with my hands, or you come to play, or I'm like, oh, you come to let me know what occupation I need to be. Or they say physical therapy. Oh, you need to walk me now.
Oh my goodness. See, that's why it's important to educate our community.
Of course. And what I tend to explain to those clients or patients, I like to say, is I give them an example. Just having somebody who had surgery can't move from their bed or get to from point A to point B, and they need somebody to do everything for them. What I do is, as an occupational therapist, I come in and I show you modification, how you can do it yourself independently. I basically treat that leg. I give modalities. We work on the whole function of the body. We don't only work on the hands.
That's awesome.
We make sure that you're able to accomplish your activity of daily living fully and independently.
That's awesome.
So
that's great. So throughout your, let's say our last question actually, through your journey, who did you have as a mentor to push you to this, incredible accomplished success that you have? Woman, tell us about it.
So it takes a community for you to accomplish your future or your dream. I would say that for me, it did take a community.
That's awesome. That's good.
I would say my husband is basically, he likes to push me, he likes to motivate me.
That's awesome.
To get to where I need to be. Sometimes we tough love.
Great husband. Good husband. Good husband.
Very supportive. And he's a computer engineer, so in that aspect, he will do all the operations for me and making sure I have all the tools that I need to get my work
Go ahead,
completed.
husband.
And then I have my sisters who are also in the medical field.
That's
I
awesome.
have a sister who's a laboratory technologist. She will, oh my God, even you don't need the advice, she will give it
Give
to
you
you.
advice.
Like, you need it, you need it. And then I have my other sister who's a DNP.
That's
and
awesome.
I collaborated with her on the weight management program, and she's been awesome. I used to actually, she inspires me in some way, and I
Awesome.
think she
That's
will
great.
love that. I said she inspires me. Which is what Dr. Lofay used.
That's right. That's right.
And they're always pushing me. They're always giving me good ideas to make
That's
sure
great.
that
That's great.
I can be the best.
That's what a
version
big
of
sister is
myself.
there for.
Yeah. So, and my parents, I would say, are there as well
Great.
to make sure that I stay in a straight line.
That's right. That's right, Karen. We got this.
Brothers, I have a bunch of brothers, so we are a big family. So
That's
they all there to make sure that I do what I'm supposed to do.
That's incredible.
And by seeing how my parents were very hardworking, pushes me as well to get to where I want to be, and I want to work and making sure that I'm giving the best quality care out there. I don't want to just focus on treating, but also care for the patients that I see.
That's incredible. Well, Dr. Paul, it was a privilege of having you in the show.
Thank
now,
you. Yes, it was a privilege for me.
Thank you. So, if with everything that you have to offer the community, if they were to get in contact with you, how can they contact you?
Okay, they can. We are located in Boynton Beach, Florida, 1325 South Congress Avenue, Suite 203, and that's in Boynton Beach, Florida. Our phone number is 561-877-5538. They can also email us. We have an email address, which is patientintake@firstcaretherapy.com. They can also go to our website, which is firstcaretherapy.com. We are everywhere. We are on Google, Instagram. Go check out our Instagram page, Facebook, so they can find us everywhere. I'll repeat the number again, 561-877-5538. And you all are welcome.
You guys, that was Dr. Paul. We really had a great lesson, awareness of everything, the facial, lymphedema, oh my goodness, therapy,
physical therapy is a bunch.
She does it all, y'all. So if you're looking for someone for physical therapy, occupational therapy, lymphedema, or get your facial, your body worked on, you want to have a six-pack, hey, she the girl to call.
Get you sexy in no time. 4 weeks.
4 weeks you can get a sexy body. Child, listen here. So yes, Dr. Paul, it was a pleasure having you. It's
the pleasure was all mine.
Keep doing what you do, girl. We celebrate you.
Thank you.
Sometimes we know it's hard for us to celebrate a powerful, successful woman. I celebrate you, woman. So continue to do what you do, okay?
Thank you, and I want to say thank you to you, Camie. You are a true empowered woman, and thank you for having me. I truly respect the work that you're doing out here. Continue doing it, continue advocating for us, and making sure that you reach to our community with your powerful words.
Thank you, you guys. So listen, again, any of you, if you have a business and you would like the community to know about it, we have Director Alan Daphnis, you guys, that's doing an incredible job in the community. I mean, he's a legend. When I said this man, there's no comparison to this man. I'm telling you, he is very nice, very sweet. He's a people person. So please, if you want TV, if you want radio air, Alan Daphnis is who you need to call. His phone number is 561-255-3909. Again, the number is 561-255-3909. Please contact Director Alan Daphnis for any business that you have in the community. He is able to give you that platform so that you can talk about your business. And again, Assured for Life, please call to cover your family. Listen, debt is unavoidable. Debt is not escaping anyone, whether if you're young, old, debt, you cannot escape it. It's gonna knock in every door. Believe it or not, those of you doesn't like to talk about death, it will knock your door. Why? Because listen here, we don't come here to stay. It's imperative that you get yourself ready for when you leave this earth, that you know for sure where you're going, okay? And prepare for when you leave this earth. Two preparation that you need to do. Make sure you are right with Jesus Christ, because there is no other man but the man Jesus, because in the last day we all shall stand before the throne of God and give an account as to what we do with this body that he gave us, with the time that he had given us in this earth. So make sure you know where you will spend your eternity when you leave this earth. And secondly, make sure you cover so that people don't have to go to GoFundMe for you. Okay, that's what a Short for Life is. There is cover 7 members of your family. I know some of you may say, I have insurance. Listen, when you do have insurance, insurance is not for funeral, because when your funeral come, you don't have that money. You have to have money aside. Reason why? Because insurance doesn't give you that money right away. Okay, whereas a Short for Life, you call us, we get into the business right then. We gave you whatever it is that we need to do for you right there. But insurance, you have 3 to 4 months to wait for that money. So make sure you are ready. Number to call, 561-313-5979 for a Short for Life. Again, we want to say thank you to all 4 Jasper lovers that are out there, Orlando, Tampa, Miami, wherever you are. We want to say thank you for allowing us to come to your home to give you this awesome awareness. Again, thank you. Be blessed. Stay with the peace of God. We will see you next time in the Lovely Camie Show. God bless you.